Hello, and thank you for joining. Glad to make my introduction. A little bit about myself. My name is Marianne Pedraza, and my educational background is in biological sciences with a minor in chemistry, and I am pursuing my Master's of Public Health at University of Arizona Global Campus. My professional experience include biotechnology, academic research, and pharmaceutical sectors. I currently lead a quality assurance team at a contract manufacturing pharmaceutical company for development and manufacturing of drug substance. The purpose of this community needs assessment was to evaluate the current health status and needs of the Hercules community and identify priority concerns affecting residents, which can be environmental, social, and health. Then prioritize the issues for actions to take for improvement. Benefits of this assessment is it identifies strengths and gaps within the community, it uses evidence-based public health strategies, and supports the development of long-term health improvement by addressing health disparities. The key focus areas for Hercules, California is 1. Behavioral health, particularly maladaptive behaviors leading to substance abuse and suicide, and healthcare access, specifically culturally responsive services. Introduction to the change process. Here we will talk about what the change process is, how is it performed, who performs it, and when. The change tool was developed by the CDC to help communities evaluate the current health environment and identify opportunities for improvement for positive health outcomes of the residents. The change framework has a structured 8-step format that guides communities for a comprehensive understanding of their overall health status while encouraging collaboration among community stakeholders. It also supports the development of sustainable policy and initiatives for positive long-term health outcomes. The tool used by the Community Assessment Tool can be used anytime an evaluation of the community is necessary. Key benefits of change. Change encourages collaboration among key community stakeholders such as public health agencies, schools, healthcare providers, and community leaders. It provides a structured framework built on evidence-based data for decision making. Through this process, communities are able to prioritize health concerns and develop actionable plans to address community needs. The assessment focused on 5 sectors, as you can see here on the left-hand side where it is the first pillar. The community at large sector examined public areas, transportation, and social supports. The community organization reviewed community services and programs. The healthcare sector evaluated healthcare and behavioral health access. The school sector focused on access to primary and higher learning institution. City youth support services and school-based programs. The worksite sector determined local job opportunities. In the next pillar, the data collection process. The data collection process consisted of reviewing local, state, and federal public health data such as census reports, healthcare resources, and community health reports. The overall time frame was rapid due to academic limitations, which was approximately 5 to 6 weeks within a capstone project of a Master's of Public Health course. Sources used included the CDC Change Tool, CD data, United States Census Bureau data, County Health Services reports, California Department of Public Health resources, and peer-reviewed public health literature. Community stakeholders. This assessment was completed independently, incorporating instructor and peer reviews. The identified key stakeholders are community members listed here for both Action Plan 1 and Action Plan 2, and they include City Council members, school representatives, healthcare professionals, county public health department, and community leaders. These individuals were chosen based on the ability to influence and support community health outcomes. They are decision makers and provide funding support. They also represent the areas of the 2 priority needs. The target audience, the target population are 1. youths ages 10 to 29-year-olds for behavioral health, and minority adults for the community need of access to culturally responsive healthcare. The Hercules Community Needs Assessment approach to data collection was to use highly feasible methods as the primary collection process, which were observation, internet research, and face-to-face interviews or surveys. This was also supplemented by moderate level methods. This mixed approach will provide an opportunity to gain an in-depth understanding of the community's perspective on health challenges and associated social and economic factors. The city is defined as prosperous. It is a suburban city with demonstrated strengths in respect to infrastructure of community livelihood. Areas for improvement are within the healthcare equity, for behavioral health and support for the younger population, which are needs for culturally responsive healthcare services for minority adult populations, and also the need for increased transportation, especially for vulnerable populations. The top three strengths in the community were determined to be: one, easy access to green spaces such as parks, trails, and recreational activities; two, diverse population that celebrates culture and has strong family orientation; and three, the city has strong educational attainment with easy access to higher learning institutions. The areas for improvement are all tied to healthcare access, behavioral health programs for the younger population, culturally responsive healthcare access for minority populations, and increased transportation services, especially to larger medical centers for vulnerable populations. The action plans were to address the top two community needs for Hercules, which were: one, the behavioral health challenges, including substance abuse and suicide risk among adolescents and young adults, defined as 10 years of age to 29 years of age, roughly 23% of the population, or approximately 6,000 individuals; and two, limited healthcare access that is culturally responsive and linguistically appropriate for racial and ethnic minority adult populations, which were about half of the population, or almost 13,000 individuals. Action Plan 1 is for behavioral health program integration in the local middle school and high school, as well as community centers to address mental health access challenges for the 10 to 29-year-old population. Proposed activities to address this are to increase behavioral health access with implementation in schools, community settings, remote services with telehealth, and development of a digital platform and peer mentoring. The expected outcomes are to increase access to care, reduce mental health stigma, and improved health seeking behaviors that will reduce mortality rates connected with substance abuse and suicide. Action Plan 2 is for increasing healthcare access to adult minority populations by implementing culturally responsive services. Proposed activities to increase access are to provide access that is culturally appropriate and address language barriers by providing cultural awareness training to healthcare professionals, implement mobile clinics, expand translation services by providing multilingual formats, hold healthcare workshops in community settings by partnering with local stakeholders, and integrate healthcare programs in the community settings such as senior centers. The next steps include sharing information to all stakeholders, prioritizing actions for improvement, securing sustainable funding, and continued monitoring to further identify any unforeseen gaps. The short-term goals from 1 to 3 years after the program implementation are to have increased awareness of available mental health resources and healthcare services in the community, reduce stigma surrounding mental health, and increase healthcare seeking behaviors for preventative and treatment. The long-term goals, which is 3 to 5 years after program implementation, are to have increased health equity, reduce morbidity, and mortality due to substance abuse, suicide, chronic and infectious diseases, leading to overall improved health outcomes. The Community Action Plan provided a structured framework for decision making for addressing behavioral health access and inadequate healthcare access. The structure guided the approach with guidance on goals, goal setting, measuring outcomes, milestones, stakeholder responsibilities, evaluation and monitoring, resource and funding for program sustainability. Lessons from this process are that the community assessments require collaboration across multiple sectors. Community-based programs are strengthened with a mixed method approach for understanding comprehensive needs of diverse populations, and time constraints can impact quality of data and evaluation. Opportunities for improvement for next year. Future assessments can benefit from an extended timeline for data collection or utilizing multiple resources with support from community members, ensuring gaps are addressed or mitigated, expanding outreach to remote services, implementing community feedback mechanism, and secure sustainable funding. Overall, the change assessment provided a deeper understanding of underlying challenges experienced by the residents of Hercules and established a solid foundation for future assessments to further improve community health. Thank you for joining. I will be happy to address any concerns and questions. Thank you for your time.